everybody, and welcome to today's forum. I am Irene Hawkins, Vice President of Human Resources and the Chief Administrative Officer for Delaware State University. We want to talk to you today about the reopening plan, but first I want to just say to everybody, I hope that you all are well. I hope that your families are doing well. As we know, this is a critical time for us all. But as we have said, as Dr. Allen has said many times, we will get through this. And together we will get through this. Also, as Dr. Allen advised us on July 7th, the university will open this semester. Delaware State has focused on students and the reopening plan for the students. And now it's time for us to focus on the employees, staff, and faculty. And we want to really provide you with information with emphasis on our safety, because that is what we really want to move towards, making sure that our campus is as safe as we can make it and that we are all healthy. So today, what we're going to be talking about, myself, let me first say that I have a panel that will be working with me. Dr. Michelle Fisher, who is the Assistant Vice President for Student Affairs and our Director of Student Employee Health. Dr. Aaron Green, who is the Medical Advisor for our Student Health area. And the team from HR, to include Ms. Pamela Gresham, who is the Director of Labor Relations and Diversity, and of course, Ms. Sandra Golson, who is the Executive Assistant here in Human Resources. So what we want to do today is to just make sure that we provide you with clarity, and at the end of this presentation, we will take questions from you and try to answer to the best of our ability. Next slide. So first and foremost, ensuring a safe workplace environment. And by doing that, we have to understand that that's going to take all of us. It's no one department or no one person. We are committed as a university to providing, as I said previously, a safe and healthy campus for all of our employees and students. And with the emphasis this year, this academic school year, on restrictions, how we operate, changes in the way that we do things, and compliance based upon what we have learned about COVID-19. So we're doing all of this in response to COVID-19. The university can maintain a safe working environment if, as I said, and I'm going to say this quite a bit, and you will probably hear the participants, especially our medical team, when they start talking about some of the different aspects of health, you're going to hear them say, if we all do our part, we can minimize the risk of COVID-19 and through compliance with university policies and protocols. So again, we want to just go over a few things with you. We can achieve our goals, and it's a goal, and we're really hopeful that we will achieve them if we follow these steps. All staff, faculty, and students returning to campus must have a COVID test 5 to 7 days prior to return. Dr. Fisher and Dr. Green will speak more about that. All results must be forwarded electronically to Dr. Fisher in the Student Employee Health. If you have a positive COVID-19 result, you must isolate for 14 days and until a negative COVID-19 result is achieved. Staff and faculty authorized to report to campus by the Student Employee Health Service must, and I emphasize must, complete the daily essential business access forms that we all should be doing right now if you're coming to campus, and have them forwarded to the Office of Risk Management. So a few guidelines that we just want to touch base. We all know it, but we want to reiterate it. It's part of our plan, our reopening plan. Just want to reiterate it. It's expected that all staff and faculty and students have a mask or face covering when entering the campus and in all buildings and in all work areas. You should be using hand sanitizers frequently and washing your hands. And Dr. Green and Fisher will speak more about that. Social and physical distancing. We've heard a lot about that over time in the media, and it should be 6 to 12 inches, 6 to 12 feet, apart from one another. We should not be in a crowded room if we can help that. DSU identification cards will be required to gain access to the campus. I would strongly advise, if you don't have one or if you've misplaced it, to please get in touch with public safety. All meetings should be scheduled and held virtually if possible. We've been doing that for the most part this spring and into the summer. We need to continue that. The use of elevators should be limited to the target occupancies that are posted in the elevator to facilitate physical distancing, and you must wear a mask in the elevator. So anytime you see crowds of people trying to push in, you need to ask them please to back out, because we have to go based upon the occupancy requirements. Restrooms, please practice hand washing protocols. We all know what that looks like. The office environment, open and shared, may need to be reconfigured to maintain required physical distancing. So if, for example, there's an open area, such as here in HR, we will have the plexiglass that's there, but again, we must understand that we have to take those precautions, dividers, plexiglass, and make sure that on the floors that we have signs for 6 to 12 feet apart. The use of university equipment such as phones, telephones, and I'm talking now inside your work areas, keyboards, computers should not be shared, but they should be wiped down often. Printers and copiers and workstations that are normally shared must be cleaned regularly. Employees are encouraged to partake of their lunch breaks, either in their office, designated break rooms, if they're available, or the university cafeteria, practicing physical and social distancing. So moving forward, department administrators, deans, and directors will prioritize those staff and faculty who can fulfill their work obligations either on campus or remotely on a full or part-time basis, depending upon the operational needs of the university. I still caution us, because our president has said that, if we have worked remotely for several months now, and if we can continue to work remotely and still maintain our obligations and our needs and our tasks, then we need to do so. Employees with childcare or elder care issues should be allowed to revise their work schedules in collaboration with their immediate supervisor with the proper documentation. The administrators and deans can incorporate, and department directors, can incorporate staggered work hours for those individuals required to be on campus to reduce the number of employees in a workspace at one time. So what we were accustomed to, a lot of 8:30 to 4:30 can be staggered, but that's at the, in collaboration with the administrators, department heads, um, and deans. Administrators must develop a contingency plan for employees who become ill to ensure that there are no lapse or minimal lapse, I should say, in the operation readiness. So now I'm going to ask Ms. Pamela Gresham to talk to you about the special accommodation process.
Thank you, Dr. Hawkins. Good morning, everyone. For the next 2 slides, I'm going to discuss the university's special accommodations process and the emergency paid sick leave. First, let's review the university's special accommodation process. Any employee who has a disability that puts them at a high risk for complications related to COVID may request a reasonable accommodation by contacting Ms. Vernice Oni, HR Generalist within the Human Resources Office. Her email address is voni@desu.edu. You may also reach her via telephone at 302-632-1742. You will be required to submit medical documentation. That's very important. You need to remember to do that. According to the CDC, individuals aged 65 and older or those with certain medical conditions may be at a higher risk for COVID-19 infection. For example, people with HIV, asthma, chronic lung disease, diabetes, serious heart conditions, chronic kidney disease being treated with dialysis, severe obesity, compromised immunity, pregnancy. These are some medical conditions that may put you at high risk for COVID. Again, if you have a disability that puts you at a high risk, you may request a reasonable accommodation by contacting Ms. Oni. It is very important to remember that you must provide medical documentation to support your request. Now, let's take a look at the emergency paid sick leave under the Families First Coronavirus Response Act. Next slide. This act allows employees to take paid sick leave for qualifying reasons related to COVID-19. Specifically, an employee is entitled to take leave related to COVID-19 if the employee is unable to work, including unable to telework. That's telecommuting or working from home, because the employee meets the following standards. It's subject to a federal, state, or local quarantine or isolation order related to COVID-19, has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19, is experiencing COVID-19 symptoms, and is seeking a medical diagnosis, is caring for a family member of the employee for the same reasons that an employee may need to use sick leave as stated above, or caring for his or her child whose school or childcare facility is closed or childcare provider is unavailable due to COVID-19 related reasons, or finally, is experiencing any other substantially similar conditions specified by the U.S. Department of Health and Human Services. You can find a link to the Families First Coronavirus Act on the university's COVID page. There you will see the qualifying reasons for leave related to COVID-19, as I just reviewed. You will also see the paid leave entitlements for the respective qualifying reasons for the leave. Keep in mind, the provisions of the Act will apply from April 1, 2020 through December 31st, 2020. Thank you. Dr. Hawkins?
Thank you, Pam. So next we are going to hear from Ms. Sandra Golson, who is going to talk about just briefly about the onboarding process that we go through and that the changes that we are making. And this is regarding domestic and those candidates, I should say, that are abroad.
Thank you, Dr. Hawkins, and good morning, everyone. At this time, the Office of Human Resources is currently only processing new hires for grant-funded positions and those that have been designated as critical hires. We have adopted a no-contact method for onboarding new employees. All pre-employment documents are sent and returned via FedEx or electronically. Notarized copies of identification documents are accepted in place of originals. New hires submit digital photos for their employee ID cards. Badges are prepared in advance of their arrival for pickup in public safety. COVID-19 test results obtained within 7 days of hire and health screening forms must be submitted to Student Employee Health 3 to 5 days prior to the individual reporting for work. Positive cases must isolate and submit negative results before they can access the campus. Department administrators will be responsible for attaining campus entry for their new employees. New hire orientation will be held virtually on a monthly basis. Hiring and onboarding international non-U.S. citizens as new employees. This section does not apply to permanent resident card holders. International non-U.S. citizens are subject to the Department of Homeland Security, United States Citizenship and Immigration Service, and the Department of State regulations. Hiring managers must advise human resources that a candidate will need an immigration visa. The three most popular types of visas we utilize at Delaware State University are the OPT. These are recent international graduates, and the applications are processed by the Graduating Institute. Candidates must also have an approved employment authorization card prior to commencement of work. Candidates arriving from another country will typically require a J-1 visa, which is processed by our Office of International Affairs. H-1B candidates are usually already living in the United States. These petitions will be processed by the university's Immigration Council. In addition to the visa requirements, hiring managers must ensure foreign degree credentials equivalency evaluations are completed prior to onboarding the new hire. New hires arriving from outside the United States and all family members accompanying them must quarantine for 14 days upon arrival in the States. Upon completion of the quarantine period, they must submit COVID-19 test results to Student Employee Health within 5 to 7 days. Start dates are contingent upon the completion of this process. Thank you.
So now we're going to have Ms. Gresham just speak briefly on the labor relations process.
Thank you. If you are covered by a collective bargaining agreement such as AAUP, Locals 1007, 1267, 2888, and 867, you will follow the provisions in your respective collective bargaining agreements to file employee grievances. All other employees should submit any complaints or grievances to my attention via email. That's at pgresham@desu.edu. Disciplinary hearings will take place when necessary. These will occur virtually or in person as needed. The labor management meetings will resume as requested. If necessary, we will resume our regularly monthly scheduled meetings, and internal investigations will continue during COVID. A few matters were placed on hold. But however, when the campus reopens and faculty and staff return for the fall, those matters will conclude. Again, all meetings will continue to be held virtually as much as possible. In-person, face-to-face sessions will be scheduled by appointment. Thank you.
So just wanted to clarify that everything that you've just heard from myself, Pam Gresham, Sandy Golson, if you need any type of clarity, please feel free to email us or to call us. We do work remote, but there sometimes we are here on campus. I know that it was brief, but we can go into more detail with you if you need clarity. So next, what we want to do is talk about employee health. And that because that has been the topic of conversation on our network TVs, in our meetings here, everything has been COVID-19. It appears to be rather COVID-19. And how do we handle those matters related to our health moving forward? So it is really good when you have a medical team who is diverse in first of all, what's going on out there and how our students, our employees can maintain their health and do everything that they can do to maintain their health. And so without really going any further, I would like to just introduce Dr. Michelle Fisher, who is our Assistant Vice President for Student Affairs and our Director of Student and Employee Health. We could not do what we're doing without her. She has been a remarkable clinician. So with that, Dr. Fisher.
Thank you, Irene. Good morning, DSU family. I am going to spend some time talking to you about Delaware State University, Healthy Together, and what that means. Yesterday, I attended a virtual health conference sponsored by the American College Health Association, and the keynote speaker, Dr. Emanuel, challenged campuses to show the world how to safely reopen. He said to do this, we must educate students to self-manage responsibly, and everyone must understand that this is a collaborative exercise. We need to create a shared understanding of what the new norms are and the proper way to approach activities such as wearing face coverings, enforcing physical distancing, and practicing other infection control measures. DSU family, we have to work together to create a culture of safety because we are responsible for each other. What I do affects you, what you do affects me. So let's work together to promote a healthy and safe campus community, as well as to protect ourselves and our families. Additionally, we have to model the behavior that we want seen. We are role models for each other and for our students. And we are fortunate that our president, administrators, and student leaders all understand and embrace the importance of putting safety measures in place so that we can return to work safely. I'm going to talk a little bit about the testing initiatives that we have. Testing is a very important tool that we are using to help prevent the spread of COVID-19 in our community. Early detection, early isolation, and quarantine help us to confine the spread of this virus. Our testing protocols include testing all students and employees prior to them returning to campus and then periodically retesting them. So our students will be tested 5 to 7 days before they arrive on campus, and then again the day that they arrive to campus. All individuals that are asymptomatic will be tested, individuals that show signs or symptoms consistent with COVID-19, and asymptomatic individuals that may have been named as a contact to someone that has COVID-19. Through a partnership with Testing for America, the university has developed this comprehensive testing protocol. There will be weekly testing events beginning this Friday and continuing until we can determine that it is safe to test less frequently. As it has been said many times, this pandemic is emergent. We learn something new every day and must be prepared to make sure the proper changes are put in place as new information becomes available. The Pandemic Task Force meets daily to assess the university's pandemic plan. Anyone who tests positive will have to isolate at home for 14 days. Although there are factors that can influence the accuracy of any test, we have been told by the lab that we are working with that when administered correctly, the test is 95% effective for positive detection and 98% effective against negative detection. You will get instructions at the time that you come to test on how to properly collect a specimen. But I need to emphasize that testing alone will not keep our community safe. Everyone must adhere to all CDC and infection control guidelines. Next slide, please. So, what kind of tests are we doing? It is a viral PCR test used to diagnose current infection. It is not an antibody test. It is self-administered, and as you see by the picture on the screen, you will insert the collection swab about a ½ inch inside the nostril. You will rotate it for about 10 to 15 seconds in one nostril and then switch and do the same thing in your other nostril. Then you will place the tube, you will place the collection swab in a tube and then place it into a biohazard bag. Again, you will be given instructions on how to do this at the time of testing. Next slide, please. I want to talk a little bit about contact tracing, because contact tracing is performed to identify individuals that have been exposed to a positive case. The University Student Employee Health Services team will conduct contact tracing for the campus in collaboration with the Delaware Division of Public Health. If you are diagnosed with COVID-19, you must notify the Student Employee Health Center. A contact tracer will call you to do a health check, discuss who you have been in contact with, and tell you to stay home and self-isolate. Your name will not be revealed to those you came in contact with, even if they ask. Test results are confidential. If you have been in close contact with someone who is COVID-19 positive, you will also be contacted by a contact tracer who will inform you that you have been in contact with someone who's positive. Again, we will not give you the name of the individual who has tested positive. A close contact is defined as being within 6 feet of a person who has COVID-19 for at least 15 minutes. You will be told to return home if you're on campus or to stay home and self-quarantine. You should monitor yourself for symptoms of COVID-19 and notify your healthcare provider and the Student Health Employee Health Center if you develop symptoms. I want to talk a little bit about isolation and quarantine. Both terms are used interchangeably, but isolation keeps someone who is sick or tested positive for COVID-19 with or without symptoms away from others. If you are sick or think you have COVID-19, you should stay home and self-isolate until 3 days after you've had no fever and no symptoms. If your symptoms improve within 10 days since your symptoms first improved, you may be released to return to work. However, you will not be permitted to return to campus until after 14 days of being diagnosed with COVID-19 and having a negative test result. You will be required to obtain medical clearance from your primary care provider and the Student Employee Health Center before you return to campus. On the other hand, quarantine separates and restricts movement of people who were exposed to COVID-19 to see if they become sick. If you had close contact with a person who has COVID-19, stay home until after, and I know this slide says 14 days, but the CDC, as of last week, has said that individuals can actually stay home until 10 days after their last contact, contingent upon symptoms. And this just shows you how fluid the information about this virus is and how rapidly it changes. You are to check your temperature twice a day and watch for symptoms of COVID-19 and notify, again, your healthcare provider and the Student Employee Health Center if you develop symptoms. Next slide, please. Together, safety is everyone's responsibility and prevention is key. Prevention is key and has been proven to reduce the spread of infection in communities, so it is extremely important that you adhere to all CDC infection control guidelines, and by now we all know what they are, but I'm going to briefly review them. That is wearing and removing face cloth coverings properly. Again, a mask must cover your nose and mouth to be effective. Physical distancing of 6 feet or more, practicing good hand hygiene, staying home when you are sick and seeking medical care, covering your coughs and sneezes, avoid touching your eyes, nose, or mouth with unclean hands, frequently cleaning and disinfecting surfaces and objects, including cell phones. I cannot stress that enough. Our cell phone does transfer germs. And lastly, it is our culture to embrace our colleagues and students. However, handshaking or hugging should be avoided. As Dr. Hawkins said, all employees, staff, and students are required to complete a daily screening form prior to leaving home. If you answer yes to any of the questions on that screening form, do not report to campus and call the Student Employee Health for further instructions. It is important that we all wear the appropriate personal protective equipment, and that is going to vary contingent upon the area that you work in. However, at minimum, all employees must wear the face coverings. It is important that you participate in assigned COVID-19 testing events and that you cooperate with contact tracing, isolation, and quarantine guidelines. Next, it is very important that you take care of yourself. So make sure you get adequate rest, maintain a balanced diet, get regular exercise. Do not neglect your mental health. This is a very stressful time in our lives. Get flu vaccines early and take all medications as prescribed. Again, I cannot emphasize the importance of self-care. We cannot take care of others if we do not take care of ourselves. Next slide, please. I want to talk about the student employee health. Now, student health has been around forever, but employee health is a new endeavor, and it is essential that we consider students and employee health concerns using a public health model. At this time, we will not be providing healthcare services to employees, and we are definitely at no time meant to replace your primary care provider. Our goal is to continue to function as the public health department in this community, putting measures in place, as I said, to protect both students and employees. Although COVID has made it necessary for the university to create an employee health center, it will continue after the pandemic. And over time, the services provided will increase as policies and protocols are developed. Next slide, please. Delaware State University, Healthy Together. What does this mean? It means that the university can maintain a safer work environment if we all do our part to minimize the risk of COVID-19. As Dr. Hawkins said, the goal is to minimize risk. Unfortunately, as I said in the student forum last week, I cannot guarantee that you will not get COVID, as I cannot guarantee that I will not get COVID. But what I can assure you is, as previously stated, measures have been put in place to promote a safe and healthy community. And I believe that together we can prevent the spread of COVID-19 in our community. I look forward to partnering with you as we work together to keep our campus community safe during this pandemic. Next, you are going to hear from my colleague of over 20 years and my friend, Dr. Erin Green. Dr. Green has been the consulting physician for this university for over 20 years, and I can assure you that he is invested in our safety and our health. Dr. Green. You have to unmute.
Thank you, Michelle. Can you hear me now?
Yes.
Okay, thank you very much. You know that since the COVID epidemic has unmasked many of the disparities in our country, we've now have to look at the pandemic, but we also have to look at a lot of other things. And as a result of that, in addition to doing our part with the pandemic, we really want to encourage all of us to look at the health and well-being of each other, you know, collectively, that we'll be able to hold each other accountable to change some of the things in our community that are changeable, some of the health consequences of long years of disparity that we, though, have some empowerment to make a change for. So I just wanted to state that first and foremost, that as we do our part with the pandemic, that we also do our part with our health and our community collectively, that we see that as a collective effort. I think, Michelle, you laid out a really good change in how quickly things are changing. Even today, I mean, there's changes that have occurred. So things that we say today may tomorrow or next week actually be different. But what has not changed, and what we know to be true, is that wearing a mask and social distancing in other countries have shown to be the greatest benefit for preventing the spread. The addition of testing and contact tracing have also, led to preventing the spread. But for absolutely preventing transmission, we know that those measures, along with hand washing, have been, by far the most significant things that we should continue to do to prevent transmission. And just wanted to mention a couple things about some of those risk factors that were mentioned earlier. And it's actually type 2 diabetes is the one that has the absolute highest risk. Type 1 has a lower risk of complications from the coronavirus. So type 2 diabetes, which is more common in our community, is the one that we're more concerned about. Also, with regard to the testing and the reasoning why we can shorten the duration now of isolation is because the particles that are in the nose that persist beyond 10 days are found to be non-viable. They're there and the is positive, but as it turns out, when they are cultured, they're not turning out to be viable. So that's really the thought behind why we're able to shorten that and make it a symptom-based kind of a protocol guideline. But beyond that, I'm just open for questions, and if there's anything specific that you'd like me to speak to, I'd be happy to.
So, Dr. Green, first of all, I want to thank both you and Dr. Fisher for giving us your overview from a clinical standpoint, and really laying out the parameters of how the employees should proceed when we come back to campus. So I really thank you for that. What we would like to do at this point is to open up the questions and answer period to our employees and our faculty who are on the line. And I'm going to ask Mr. McMillan to facilitate that for us.
Good morning. What I'd like to do is we'll take a look at the questions that we have. If you have a question, please type it in the chat and we will look to take care of that question with the panelists that are here. So the first question that I currently have is, does an employee have to be full-time in order to qualify for emergency paid sick leave?
Ms. Gresham?
Sure. Part-time employees are eligible for leave for the number of hours that the employee is normally scheduled to work over that period. So yes, they are entitled to emergency paid leave.
Great. And the only other question we have is what medical documentation does Ms. Oni require? I believe that was something that was stated earlier about sending information to her. Is there specific documentation that she requires?
Sure. When requesting a medical accommodation, you should provide Ms. Oni with a doctor's note. You should also indicate the date for which you request to leave, the reason for the leave, and a statement that you are unable to work because of the above reasons. So you don't want to just indicate, submit a blanket request. You want to indicate the reason for the leave and the statement that you are unable to work because of your reasons. And then if you're requesting a leave because you need to care for your child whose school or place of business is closed or the child care provider is unavailable, you want to submit the name of your child, the name of the school, place of care, or the child care provider that was closed or become unavailable, and a statement that no other suitable person is available to care for your child.
Great, thank you.
Are there any more questions, Mr. McMillan?
Yes. Is there a schedule or calendar available for DSU's on-campus testing?
There is not a schedule at this time, but we will be putting one together shortly, and that will be posted. Gerald, may I ask a question that came to me by my phone for Dr. Green?
Sure.
Dr. Green, can you clarify, does asymptomatic individuals remain that way or do their symptoms go away?
Mm-hmm. There's two parts of it. Remain asymptomatic throughout the course of them having the virus. And then there are those who are asymptomatic and who become symptomatic. So we consider them like pre-symptomatic, and then they develop symptoms and the symptoms go. But for both cases, the incubation period is still about 5.2 to 5.3 days. That's the incubation from when the time that they've been exposed to the time that they generally present in the average. Now they can go up to 11 days, but generally that's when most people develop the symptoms. So the answer is that based on symptoms now, because of new data that we have, prior to just this week, we didn't know this, but now we know that if someone is asymptomatic and they let us know and we test them and they're positive, that 10 days from the day that we test them, if after 10 days they have no fever and aren't taking, Tylenol or Advil to suppress it, are improving with return to like cough or shortness of breath, if their symptoms are improving, that we can allow them to come out of any isolation at that point.
Okay.
Great. The testing this Friday is considered to be for essential employees. What considers you to be an essential employee?
So let me say this, the testing this Friday is for essential employees, and we all, if we're coming back to campus, either in a full-time capacity or a part-time capacity. As we've said from the start of this presentation, no one can return unless they have taken a COVID test, and that test is negative. So it's not just for those people who were deemed essential during summer, but essential, if your respective administrator, dean has has said you should come back to campus starting whatever that date is. And I know that some will be coming back within the first week in August, and that's, and if I'm wrong, Dr. Fisher, correct me, because they're looking to come back the first week in August. That's why they are testing this Friday. But in terms of what's essential, you really need to talk with your respective administrator, your dean, your department head, because a list was provided to our general counsel, to our chief risk officer, to alert her who we want and need to bring back to campus, either on a full-time or part-time basis. Those who are working remotely, we're not asking you to come on campus to take a COVID test unless you will intermittently work remotely and come to campus. Am I correct, Dr. Fisher?
That is correct. And it's important for me to stress the reason why we have said within 5 to 7 days prior to your return to campus. If you aren't scheduled to come to campus until next month and you get a test now, it means nothing to us as far as clearing you to return to campus. Because the reality is you can be negative today and positive tomorrow or a day from further on down the line. So again, 5 to 7 days before the time you are scheduled to come to campus is when you must get the test.
Great. What will be the frequency of testing for faculty and staff? Also, when and where will that testing be accomplished?
Dr. Fisher, you want to take that?
Sure. Again, we are discussing the frequency. A testing event will be held on campus on a weekly basis, but we are determining the frequency of how often an individual needs to be tested, and it's sometimes going to be determined about where you work. For instance, as an employee who works in the student health center, I need to be tested more frequently, and I need to be tested on a weekly basis. The other thing and then we have some student populations that need to be tested on a weekly basis. Our students that are going into clinicals and hospitals will need to be tested more frequently. Depending on other things, like if you're an athlete and you're going to be practicing, you'll need to be tested more frequently. And so will the employees that work with those students. The other thing we will be doing is random testing. So you may get an email that says you have been selected to be tested this week, and we expect you to comply with it. And random testing is because, again, we are doing surveillance so that we can identify individuals who may not have symptoms but are positive, so that we can intervene early and isolate and quarantine and stop the spread of infection. Dr. Green, would you like to add anything?
Only that there will be some case-by-case situations that will, kind of alter that picture, and as information becomes available, new information becomes available. But I think what you described is exactly right. I mean, we're going to do, testing and do some of the testing, like you said, without necessity for any symptoms. But I think it's going to be very important that we continue to stress that is a part of it, but the other big part of it is sort of self-isolating ourselves when we feel different or we have different symptoms, and kind of being mindful that the spectrum of symptoms have grown tremendously since the beginning. And like loss of taste, we've talked about that, loss of smell, having joint, just being more mindful that things that we may not have paid attention to in the past may or may not be COVID related. And I would just say we would just act on the side of caution and say that perhaps these symptoms should be evaluated and reach out to a PCP or employee health, in this case if it happens while on campus, just to be mindful that it's not just a fever and it's not just a cough and it's not just shortness of breath, but this virus is able to essentially affect pretty much all of the systems, including the neurological symptoms, the dermatological symptoms. There's a lot of dermatological things now. So just being mindful that things that are just unusual to you may, be COVID related. Not to be paranoid, but at the same time, cautious.
All right.
Thank you, Dr. Green. I'd like to add one more thing too. While we cannot control employees, students, activities off of campus, we do ask that you be mindful of your travel and mindful of the people that you interact with. Because ideally, if we can even create what's considered a quasi bubble on campus, it will help to facilitate our safety. And so what that means too, and it's been said before, if you should travel somewhere, and that doesn't just mean out of the country, that could be another state that has been identified as a hotspot. It is very important that you notify the Student Employee Health Center of that as well.
So just to kind of just back up what Dr. Fisher just said, I know that we will be preparing policies and procedures along with Dr. Fisher, along with the Office of Risk Management, with regards to just that, travel hotspots in and out of the country. Understand that back in March, we had communication from our president, which indicated that if you do travel out of the country, that you should notify HR of that. And I know we talked about even having people quarantine. But what I want to be able to say to you all, because we're getting to the hour where we've got to wrap up, is this. There will be communication. You will see that communication from the Student Employee Health Service. You will see that there will be communication from the Office of Human Resources. You will see communication from the Office of Risk Management. We will try to keep you abreast of the changes, of the compliance, things that we need to comply with, regulations that we need to comply with. Understand that there will be a policy coming out soon that you are expected to review, and you will attest to the fact that you've received it, as we do most of our policies here. It will go up on our website. So we're going to try very hard to keep you abreast. If you do not understand the individual or the department who can help you with that, I'm sure that it will be located somewhere on our website who to call. But what I want to do, Daryl, did we have any more questions? Because I know we're getting to the top of our hour.
Yeah, I think at this stage there are a few, but I think that as we normally do, we will make sure that the questions that have not been answered will be forwarded to have reviewed and responded to off of our site. So that'll be taken care of from that perspective.
Okay. So what I would like to do at this point is to first thank our panel for their input. Thank you for giving us the oversight that we needed to have as we open up the campus, as employees, as faculty, staff. We just hope that you will stay safe. Contact us if you need to, and just know that we will get through this together, as we normally do here at Del State University. Thanks so much and have a great day.